Hi Year 9, my name's Mrs Lewis and I am one of the health and social care teachers that you might come across if you decide to pick health and social care as a course. So the course that I'm going to be talking to you about today is called the Level 2 Tech Award in Health and Social Care, and I'm going to give you a bit of an introduction about what the course is all about in this session. So first and foremost, I want to just talk to you about the structure of this course and see whether this is something that you might find suitable for your learning needs and learning styles. So as you're probably already aware, BTEC isn't quite as exam heavy as your traditional GCSEs. So within Health and Social Care BTEC, you'll have a little bit more assignment based coursework with a little bit of exam added in. So however, it is still equivalent to one GCSE. So it's still the same, you're still getting the same out of it, it's just kind of structured in a different way. There's 3 units that you'll be working on over year 10 and year 11, and all of those 3 components will come together to get your final grade at the end. Now you will get graded individually for each of those units, but you'll also have the opportunity to have lots of feedback from your teachers who can help you to get the highest grade that you possibly can. So it's not all based on that exam element where you're just kind of left to it. When you've got the assignment side of it, that kind of really helps you to give you confidence that you can get those higher grades. So it consists of 3 components or 3 units. The first unit we will learn about is called Human Lifespan Development, and that's all about, in that section we learn all about the development from when somebody is very first born all the way up until they come to the end of their life or in their later adulthood. So yeah, it's a real big section about what you need to know, but it's really interesting. So you're learning all about the physical development of babies and children, the intellectual development that happens around adolescence, the emotional and social development at each of those different life stages. And also within that unit, we look at the different factors that can maybe get in the way of someone being able to develop in the more traditional way. So that's also really interesting too. And then for component 2, we're looking more about, I suppose, the world of work in health and social care. So we're looking at the different services that can be used, we're looking at the different professionals, and we're looking at how those different services and professionals can help care for vulnerable people and service users within our society. And then finally, you'll do the component 3, which is all about health and well-being. So within this is the exam element of the course. So components 1 and 2 are assignment based, and component 3 is that exam, and you tend to do that exam at the beginning of year 11. So within this unit, it's all about understanding what makes us healthy, what we can do to maintain a healthy lifestyle. And the exam is really for you to be able to set targets to a specific individual and kind of understand maybe where that service user might struggle to reach those targets. So lots of really interesting things, lots of stuff that you've probably come across before in your everyday experiences, which makes it even more interesting to learn about. Okay, so let's have a go at doing a couple of tasks. Let's see how much you know about health and social care already. Some of you might know quite a bit. Some of you might have experienced firsthand health and social care services, Or some of you might have no experience and think you don't know anything about it. It doesn't matter what level of knowledge you come into on this course. We'll all be learning the same, and we'll all be building our knowledge on these areas as much as possible. But let's have a look. Let's see if what we can do on the first opportunity. So what I want you to do is I want you to have a think to yourself in just 30 seconds and see how many different health and social care services that you can think of. So when we're talking about services, we're talking about the places that you go. Okay, so this could be, for example, a GP surgery or the dentist's surgery. What I don't want you to write down is different professionals, so the people that are involved in health and social care. I just want you to write down the services, so the places that you can go to get help for health and social care services. Okay, so 30 seconds. Okay, good. So hopefully you've written, I don't know, hopefully at least 5 different services that you can think of. And I think there'll be some services that you come across that you go, oh yeah, I did know about that one. I just hadn't quite thought about it at this moment. So again, like I said, it doesn't matter what you know or don't know at this point. It's all about learning. Okay, so hopefully you've got quite a few on your list. I've got here a few on my slide, but this is just a small number of services that you might come across. So there's lots and lots more than this. Now the first one I've got here is hospital. Now a hospital will have lots of different services inside of that hospital. So from an A&E department, a physiotherapy department, or maternity department, and that along with many other services in amongst that one building. You've also got the doctor's surgery, so I would imagine most of you, if not all, have at some point been to your local doctor's surgery with minor illnesses or minor ailnesses or minor injuries. Then you've got the dentist, so that's another service. Again, most of you, if not all, have probably visited the dentist at least once to look at your teeth and check that that you've got good oral health. You've got accident and emergency department, so again that's within the hospital. So if there's something really bad happened to you, you've had a major incident or injury, you might go to A&E and they might look at how they can help you. The pharmacy, so that's like the chemist that you might go to. Pharmacists can also give you advice on minor illnesses and ailments as well, so sometimes it's not always necessary to have to go to that doctor's. And then we've got residential care homes, so that's where you might have vulnerable people go and live and be looked after by carers actually inside a building. Then you've got social services, so that's things like social workers, health visitors. And also some of you might have come across before CAMS, which is a mental health service for children and young people. What I would love you to do now is just to have a think about your list and maybe the services on this list here, and think whether you can categorise them into social care services and those that are healthcare services. And I'm just going to give you 20 seconds just to have a look at them and maybe put an S or an H next to your list if you think you know. Okay, so I'm just going to give you 20 seconds. Right, fantastic. So if I go through this list here, So the first services on this spider diagram I'm going to talk about first are healthcare services. And healthcare services are services that help any physical problems that you might have, okay? And they do tend to revolve more around the physical illnesses and injuries. So the first one is hospital. That's a healthcare service. They deal with lots of different healthcare problems within that building. Your doctor's surgery, so you might go there initially with lots of different health concerns that are going on with your body or your brain, and then they will then refer you out to more specialist people if they feel that it's needed, or prescribe you with medication. You've got the dentist, so they're looking physically at your mouth and your teeth. Accident and emergency is also healthcare, because again they're just that first aid, that first lot of trying to fix you if something is broken within your body. And then you've got pharmacy. Okay, so a pharmacist, you go and you can get medication, different little bits of advice about your health. Okay, so those first 5 are all healthcare services. Now, social care services is a little bit different, and that's all about your social side, so helping you emotionally and helping you to live every day effectively. So you've got your residential care homes, you've got CAMS, and you've got social services, and they are all social care services. So it's really good to know, and that's kind of the first thing we always learn when we're starting health and social care, is the difference between those 2 services, because one day you could be working in one of those services. So now we know what services we got, we now need to know what we are dealing with. So let's think about the needs that people have for them to be able to live a happy and healthy life. So very quickly, again, have a think to yourself and note down and make a list of all of the needs that you think are essential to somebody living a healthy life. So what do you need to live a happy and healthy life? So I'll give you an example. So shelter, so having a house, a roof over your head, that's going to be essential for you to living a healthy life. What other things do you think you need to be able to live a happy and healthy life? I'm just going to give you 15 seconds to think about that. Okay, so hopefully you've got a few different items down there. So maybe shelter, you could have put down money. Some of you might have put down being able to go on holiday. Some of you might have put down food and water. All of those things are needed for us to live a happy and healthy life. But there's other things as well, isn't there, such as like family and friends and the social side. And that's what we look at. We look at all elements of our health. So in health and social care, when we're thinking about our needs and what we need to be able to maintain a healthy life, we talk about this acronym PIES, okay? And each of the letters of PIES stands for a different type of health. So we've got physical, which is our body. We've got intellectual, which is the way we think and how we learn. We've got emotional, which is how we feel, and social, which is the friendships and the relationships that we develop. And what we say in health and social care is for you to be truly happy and healthy, you need to be happy and healthy in all of those different areas, because they all have a knock-on effect to one another. So that's really health and social care, and a bit of an introduction about some of the things and some of the foundations of what you need to know to go on to a health and social care career. So, and that could be by becoming a nurse or a care worker, working with the elderly, or a nursery worker, working with children, or it could be, say, working in a school, like somebody in R12, looking after vulnerable children. You could be looking at even maybe going on to become a doctor or anything like that, a pharmacist. All of those different jobs are available for if you did, say, wanted to work in health and social care. And this course is kind of a starting point there. So I really hope that you've enjoyed this little section, and I hope to see some of your faces in September. Okay, bye.